Hi, my name is Ali Terracino, and I am currently interning at the Center for Service and Social Justice. And today I have here with me Marie Onakavich, and she's going to be talking to us about the NAMI organization and what they do for the community. So I want to say thank you again for being with us today and expressing all about your wonderful organization.
All right. All right, Allie, I'd like to thank you for giving us this opportunity, for giving me, on behalf of NAMI, this opportunity to talk about what we do. Every opportunity that we have to raise awareness in the community helps us further along on our mission. So we really appreciate it.
Yes, thank you.
And that really, I mean, and that brings me to, you know, what do we do? What do we do in the community? Our mission is to help build a better life for anybody that's been affected by mental illness. So that's individuals themselves, family members, friends, because we know, you know, it's not a solitary illness. Once one person experiences it, anybody who cares about them is affected by it. And we also know that it's much more common than people might realize. 1 in 5 of us are affected by, you know, some kind of mental health condition. 1 in 25 by a more serious chronic condition, but 1 in 5 of us are affected in some way. So we know that there's a great deal of people out there who can use our help. What is it that we do? One of the major things we do is provide support. We have support groups that meet throughout the community, and the purpose of those groups mostly is to let people know that they're not alone. They're not very often, because of the stigma and shame that goes along with mental illness and symptoms, people feel isolated, they feel alone, they're not sure where to turn, they're not sure who and how to talk about it. And it gives people the tools to talk about it, the words, the way to express themselves, as well as they give them an avenue that, you know, in our support groups to talk with other people who've been affected in this way. We, in addition to our support groups, we have several education programs that we hold in the community. We're about to start something called a family to family program, which is an 8-week, 1 night a week for 8 weeks for family members. And it's basically, you know, everything you need to know to support your loved one with a mental illness, like 101, you know, like it would be like attending a NAMI meeting and getting all the support and information and lived experience. You know, if you did that for 10 years, you get it in this 8-week program that was created by our national office with the input of family members and persons with mental illness. And it really is, you know, how to understand the illness, how to support your loved one in their recovery, how to take care of yourself. We have something called an In Our Own Voice program, which is a program that gives a voice to persons living with mental illness. It gives them a format to share their story in a way that's candid, but also inspiring. We offer that in our community, and we have folks involved in that. We have some presenters who are, you know, a handful of them might still be in an intensive treatment program, and some of them are working full-time in the community. So it's such an array of individuals who are affected by mental illness. We offer mental health first aid and youth mental health first aid, which is 8-hour programs for anybody who's interested in making a difference in the community. Anybody who wants the tools to be able to recognize and respond to somebody who might be in crisis or might be beginning to experience a crisis. We're involved with our local CIT program, which is Crisis Intervention Team. We teach law enforcement and other first responders how to respond to someone in a crisis. Great deal of University of Scranton police department members have participated in that program. We participate in any kind of community event that might be helpful for us to raise awareness, you know, community health fairs, different community presentations. So we attempt to raise awareness, like I just said, in any way that, through those community events, through our Facebook page, through our website, through brochures, through flyers in the community. We have events that this year, and maybe we could talk about them in a little bit this year, where they looked a little bit different than they usually do, our community events that are meant to raise awareness. But, we're doing, just like everyone else, we're doing the best that we can.
Yeah, I was going to just say, it seems like you guys have a big handle on it and you're not letting anything stop you, which is wonderful because the world, unfortunately, has not stopped and it continues. And this time right now is very hard for a lot of people, and I think it's underestimated.
Yeah, I agree with you. And we want to make sure that we find a way to be there for people and to let them know, number one, they're not alone. Right now, we all feel very, very alone, and we find different ways to engage and reach out and communicate. And we're working very hard to try to do that. Yeah. Thank you for noticing that.
What do you find as the most important needs of the community?
That's a tough answer, because every individual, to each system, their need is the most important. But, we're focusing on mental health. So I would say, the most important need is people having access to the services that are out there. We know that treatment works. We also know that for a variety of reasons, there's a lot of challenges. People have a lot of problems accessing mental health services. It's not always adequately covered by health insurance, and sometimes when it is, there's co-pays that can be a challenge for persons. We're in the middle of a national shortage of psychiatrists, and we're feeling it keenly in our area. Several years ago, Commonwealth Medical College established 4 psychiatric residencies, and we're really hopeful that some of those residents will stay in our area when they complete their residency. So we'll have a little bit more folks here. So, I would say access to those services, because when people do get help, it works. Yeah. But it's getting to it.
Do you feel, if any way, how has your organization been affected by COVID-19?
Well, kind of like I hinted at before, we're a community-based, peer-to-peer, grassroots organization. Everything we do is from the ground up, from our support groups to our walk for mental health, our mental health awareness is in the community. So COVID-19 restrictions made a lot of these things impossible, at least to do the way that we were doing them. But NAMI, we've been around for 40 years. We've always had to be flexible. We've always had to figure out a way to make things happen. We've always had to be innovative, and we are. We adapted by very quickly offering our support groups live on Zoom. We created some events that could be done independently in the community, but still encouraged engagement and created that sense of connection. We've held virtual treasure hunts that have been a lot of fun. Our national organization quickly adapted the education programs that I mentioned earlier to a virtual platform. The upcoming Family to Family program is going to be offered both virtually via Zoom and at the same time in person, because we're able to do it in a venue that has a lot of space, and we limit the amount of people who are there. But for folks who want that in-person experience, they'll have that, and we'll be able to reach folks who just feel a little bit more comfortable staying home right now. So I mentioned before, our walk for mental health awareness, we had to cancel that, and it was such a difficult experience because we've held it for over 20 years in our community. It's something that people begin to look forward to as soon as we finish one. So we had to figure out a way to try to continue to support people. May is Mental Health Awareness Month. And so what we did was, throughout the month of May, we used our social media to really encourage people to begin to establish healthy habits and giving them tips and giving them, different links to different information pieces throughout the month. And we finished that with a separate but together virtual walk on May 30th, which had been designated the National Day of Hope. So we had a little bit of fun with that. We sent registrations a length of ribbon that we have that we use in other events that says find hope, find help, find NAMI, which is one of our taglines. Contact information. But we sent it to registrants, and they used it as they cut the ribbon to start their walk. Some of them used it like to show that they were finishing their walk. Some folks wrapped it around themselves kind of like a sash as they were walking. And so we had a little bit of fun with that. And then they posted pictures on social media, and afterwards we sent them some NAMI swag, some things that we normally give out in the community, but we haven't been able to do that. We're not able to do our annual fundraising gala, which it's going to have a major impact on our budget. The Evening of Hope is another event that I think people look forward to. We have always tried to make it really fun, but we're looking at other ways to harness the community's generosity. We're launching a stigma-free company program, which the NAMI created, and it uses video and other information, flyers and graphics to help companies create environments that are more supportive to their employees who might have been affected by mental illness. And we're hoping that some companies will choose to sponsor those programs. We've entered into a collaboration with a local coffee roasting company, Black and Brass, out of Honesdale. And this is actually like the first official announcement of it. We're going to do, they created a special blend for us that was stigma-free, of course. And we're going to sell that as a fundraiser. So I'm hoping that will, again, reach people in a different way. So, there are a couple of the ways we've been affected, and a couple of the ways that I think we've adapted.
Yeah, I was going to say, I mean, honestly, like, it's going to definitely be a challenge to do everything that you used to, but it seems that you guys have taken, like, full control of what you want to do, how you want to do it, and how it would be safe for everybody to participate, which is wonderful.
And that's obviously a priority, finding a safe way to do it. Like you said before, the need hasn't gone away. The need for mental health support is in fact quite the opposite. The need has probably increased, and so we made a commitment to find a way to meet those needs in whatever way that we can.
Well, that's wonderful, and it's definitely helpful, and I'm sure many people are so appreciative. My last question is, are there any ways that people can help and get involved and volunteer?
Yeah, I mean, we still need people to help us achieve that goal. We're a small organization with a lot of grassroots, a lot of volunteer involvement. So we absolutely, we're as we're adapting to the virtual world, we're learning as we're working through there. We're learning that some of our, when we have an event, if it's like the family to family, if it's some kind of presentation on Zoom, it really helps to have a backup, a producer, so to speak, to keep an eye on the audience, to see what needs are, to troubleshoot any technical problems. And so, anybody who might be savvy in that sense, we could really need some help. Our outreach looks a little bit different now. We used to be able to be in the community at those health fairs and distributing information, and we're not able to do that anymore. So now we've begun putting together packets with brochures and information graphics, lists of resources in the community. But I mean, these, as simple as they might seem, they take a lot of time to put together, enough of them to really distribute in the community. And we leave them at places where we know people will be, or we've been mailing them. We've been, sending them to community mental health centers to ask them to put them out. But, some help putting these together is another way that really would make a difference. We have NAMI has created a lot of documents that are, kind of general in nature that we would like to make more local, add local information to, so adapting documents. We always welcome more participation in those programs that I mentioned, that in our own voice, somebody with the lived experience who would be interested in learning how to share their story and sharing their story, we would welcome that. We don't offer right now, NAMI has a program called Ending the Silence, and that's a program for younger people. It's like in our own voice, but the audience and the presenters are I think people under 30 and under with the lived experience.
Wow.
I would love to be able to offer that program. And that, again, is meant to give hope and inspire other people who might be struggling. I'd love to be able to offer that. I just need people who would be willing to participate, to share their story. Videography skills. We again, as we're adapting to this virtual world, being able to video some of these presentations and offer them in different ways in conjunction with that stigma-free company or some other things that we'd like to put together. But somebody with videography skills who can help us do that would be wonderful. Our website, our social media, our online newsletter, they always benefit from a variety of input. I get stale after a little while. So anybody with anything interesting is really welcome.
Okay. Well, that's great. And part of the reason why I'm doing these interviews is to get the word out about the organizations around the Scranton area, and to get kids involved, to help out and spread the word and show there are still opportunities and people do still need some help. So yeah, I want to thank you so much for talking with us today and informing me even more about this wonderful organization. It's been very eye-opening, and thank you. I really appreciate it.
Thank you very much. We had some University of Scranton students last spring sign up to volunteer with us right before COVID restrictions, but even though it changed a little bit how we ended up doing things, they still came through. They created a video for us to raise awareness during Mental Health Awareness Month, and they created the resource list that I mentioned that we have. They put that together of all the local resources in the area. So, you guys are making a big difference. You can continue to make a difference in the community with NAMI and with other work that whatever anybody chooses to do, it enriches our community, and we're appreciative of it.
Well, thank you so much again. And
thank you.
It's been very interesting, and I'm definitely gonna spread the word to people I know. And thank you so much.
Thank you. Contact